After the 2-level fusion, I was in the hospital for 2 nights. Think about what that was many years ago. You'd have been in there for weeks or months.
Most patients, I think, are having a hard time. The first 2 weeks, patients are saying, why did I convince myself Dr. Chang could do this surgery? But then after that 2-week window, patients start turning the corner.
As I was waking up, I was still under the influence. But I did know that at that point in time, the pain in my leg was gone. I was like going, I don't care about the rest of it. I'm good. I'm good to go.
The pain with these surgeries is really significant. In the hospital, they give you a lot of pain meds, a button press thing where you can give yourself Dilaudid or morphine every 8 minutes.
And then you wake up a little bit more and you start to feel the surgical pain and you're kind of going, oh God, this is bad.
Recovery after a fusion is a big deal. Most people stay in the hospital for 2 or 3 nights. They're up and walking right away.
And then a couple hours after surgery, they had me stand up out of bed, which I thought that was absolutely insane, but I was able to do it.
They gave me a walker and I started walking around the corridors of the hospital.
I'll tell patients they need their rest, they need their nutrition, they need maybe vitamin D and calcium to help get the building blocks for that bone.
Recovery from a fusion obviously varies person to person, but in general, most people's surgical pain lasts for 6 to 8 weeks.
It's going to be 6 weeks before you even start to begin to feel like yourself.
We generally start physical therapy around 8 to 10 weeks when we think the muscle pain has settled down and their muscles are starting to fire to where they can protect that segment and work properly. Typically, for the fusion to occur, it takes 3 to 6 months. So we don't want to start the activity too early before we think we have some bone growth in there to provide some stability.
The doctor tells you all these things you're not supposed to do. And there's some really good ones on the list, like you're not supposed to sweep. It's kind of a weird motion that's not good for your back. So that's a nice thing not to have to do.
The back fusions I've had with my current doctor have been much easier to recover from. He believes in getting you up and out as soon as it's reasonable and possible to do it, and that's helped psychologically.
You gotta walk before you run. So some guy wants to go back to running 6 miles a day, yeah, that's a worthwhile goal. But let's have you walk 100 yards first.
One of my targets was to be able to go out and play tennis again. I remember it being in March of that year, so really kind of 4 months after I started physical therapy, that the physical therapist said, you can go out and play tennis, but he was only going to allow me to hit off of a machine, because that way I knew where the ball was coming and I wasn't making any herky-jerky movements.
2 months after my surgery, I want to get back to playing golf, and we've kind of set a timeline. It's late summer, 9 months after my surgery, which we all feel is manageable. You know, I want to get back to mountain bike riding. I want to get back to doing boot camp. I want to get back to playing basketball. I know it's going to take some work to get there.
So really a fusion takes a year to sometimes even 2 years to recover from, because a lot of it is the pre-existing pathology before the surgery.
It wasn't this realization that, oh my God, I'm pain-free, because I'm not. I just flew all over. I just came back. My back hasn't felt this bad for the last few days, so I'm not pain-free. I just have my life back again. I can live with this type of pain.